So what should couples do to improve the chances of success rate in the IVF, sir?
I mean, they have to follow the instructions of the gynecologist. Yeah. That's pretty simple. All the other parts are basically within our control, about the laboratory, about the quality. They have to, as much as possible, to follow a healthy life, as usual. Avoid contaminants, to have a healthy food, to make some sport. I mean, those are general rules overall to improve also a bit the potential of those gametes and the fertility. But otherwise, they have to follow the instructions.
So what is cryopreservation? Why is it related to IVF?
Cryopreservation?
Yeah.
I mean, again, it's one of the most critical aspects in the laboratory. Cryopreservation means to freeze something. Cryopreserve is freezing. Yeah, okay. Basically, we can cryopreserve oocytes, we can cryopreserve sperms, we can cryopreserve embryos. We can do all these things so that we have this material available for the cycle at any moment. And it is especially important when you are talking about egg freezing or egg cryopreservation for females or women that wants to postpone this decision to become a mother, and you need to preserve this potentiality through some years, yes, obviously, but also to optimize our cycles. So we are able to have, in one particular stimulation cycle, we are able to have 10 oocytes, and we have maybe 5 blastocysts. We need to optimize all these 5 blastocysts. So we have different chances and different embryo transfers to get a pregnancy within the same cycle. And to do that, you need to have this cryopreservation program. So you are able to have in your laboratory all those samples, embryos or oocytes, within liquid nitrogen under almost minus 200 Celsius degrees, which is very cold, so that you can have all this potentiality with you for so many times. And you need to have that also in place. You need to be able to reproduce that.
So in the period of the menstrual cycle, what is the best time to retrieve the eggs?
I mean, I can reply that answer, but it's quite medical. I mean, okay, maybe I should not reply that.
Okay, you won't retrieve the eggs, sir? Like,
yeah. I mean, the menstrual cycle and natural cycle is like 28 days.
Yes.
There is like a natural stimulation inside with the hormones for the women. And then after 15 days or so, there is an ovulation. And if there is no pregnancy, then you have menstruation at the end of these 28 days. When you do this in a stimulated cycle with a gynecologist, you are mimicking the conditions, but you are giving extra hormones, external hormones. So you have also more number of oocytes retrieved. Okay. So whenever you have the time in which the natural ovulation may happen, you have to mimic that, and you have to extract this artificially in an OT, in an operation theater. Okay. And we do this in the clinics. So we extract through an ultrasound and with a needle all these oocytes from the ovaries by the time that naturally they should be ovulated. But again, it's something quite medical, and I am an embryologist, so I shouldn't be the one talking about this.
So how do you handle cases in which there is a poor quality of embryos in multiple cycles? Again,
we have to investigate the reason for that, because there are multiple factors which could be affecting poor quality in the embryos. First thing would be to check that everything in the laboratory is working fine. Okay. That's the first point. If you are sure that the conditions, the quality control, everything is working fine, then we can be focused on the patient, the patient history, patient detail, patient profile, and we can analyze everything. It could be a sperm factor. If that's the case, we can do something about giving also vitamins or antioxidants to the male for some time to improve also the quality of the sample. If there is an oocyte factor, we can try to also change the stimulation protocol in next cycle. We can also try to offer PGS, if that's the case, also to investigate about the chromosomal status of the embryos. We can offer also donors, if that's the case, also because maybe the quality of the oocytes or the sperm are not good enough. I mean, it's very variable, but the point is to have all the possible tools to investigate the case and to have a customized answer for each patient.